Hi, thank you very much for visiting our website or our YouTube channel. I'm Steve Shore, and I'm very glad that you came to our website to uh, check out our video. So I'll go over the Medicare and You manual. It's an official publication from Medicare and go over, in general, what a Medigap policy will do for you and how it will fill the gaps of what original Medicare A and B do. And then you'll also need to get a Plan D for um, prescriptions. You're not mandated to, but you practically are because it's you get big penalties if you don't. And that, I won't go into that in this video. We're just basically going by what's in the official government publication. I'm trying to keep it all generic. So here's our lesson plan for today. So let me show you my biography and my time and experience in the business. So I graduated San Diego State in insurance a long time ago. I also earned the Chartered Property and Casualty Underwriter. As a teenager, I earned the Eagle Scout Award. I participated in Life Underwriter Training Council Fellow. I'm a registered employee benefit counselor and a registered health underwriter. And I'm licensed in the state of California. And if you scroll down, you can find the link to my education with the California State Department of Insurance. I haven't been getting degrees lately. I figure maintaining this website is keeping me up to date. But the mandated education I'm doing. If you want to contact us, we'll have all the links at the bottom of the YouTube video. Here's our business card. You can email us using the form, or you can email us using the red button. And at the bottom of every page, it says, ask a question. We're happy to ask questions on the website. You don't have to put in your name. And, we'll answer any question that we can look up. It's what we live for. So let me close out that screen. We went over the biography. Okay, so here's the Medicare and You manual. And I like it because it's got a table of contents, so anything you need, you can just look here and skip to the page. You don't have to read all 52 pages. We're only going to go over maybe 10. Your various parts of Medicare. Okay, you've got Medicare Part A is hospital, and that's generally free as long as you've worked at least 10 years in the United States and you're 65. Part B will run you in 2020 $145 a month, and that pays for doctor visits. Part D is separate, and that covers your prescriptions. So basically you have two options, Medicare A and B, and then get a supplemental or Medigap plan. You can also add in Part D. If you get a Medicare Advantage plan, that's sometimes known as Part C, but I only think that's confusing. So it's Medicare Advantage or MAPD. And you have to have both Parts A and B for that. And generally, it includes Part D prescriptions and may throw in some extra benefits. We won't go into that in this video. So what is a Medigap policy? I'll show you here, and then I'll show you on a generic actual form from a Medigap company, because there I think it explains it the best. But Medicare doesn't cover everything. There's hospital copays, there's copays for the doctor. Long-term care is not covered. It's not really covered in the Medigap either, but it's just, there's just no thing as everything's covered. So if we go here, Plan G will be probably the most popular plan, coming up in the future. Because if you're turning 65 in 2020 or beyond, you can no longer get Plan F. The difference isn't that big of a deal, in my opinion. The only difference is the $198 of Medicare out of hospital expense. So you would pay that. And then you got to look at the prices. But this is a general video, so we're not going to go into the prices. Give me a call, check my website. You can get it all there. So going here to Plan G, so the brochures, and depending on the company, they may offer Plan G Extra. Extras means it has extra dental and extra vision on top of what Medicare does. So the companies are just trying to be competitive. So Medicare in the hospital, your first 60 days, Medicare pays everything except $1,400. Medigap Plan G will pay for that deductible, so you pay zero. And then if you're in the hospital longer, there's different co-pays, but with the Medigap plan, you pay zero. God forbid you're in the hospital more than 365 days, you got a problem, because Medicare nor Medigap will pay for that. Skilled nursing facility, first 20 days, they pay everything, 21 through 100 days, everything but 176. Medigap will pay that. And beyond 100 days, Medigap will pay that. But skilled nursing, and it's confusing. I've got another video on long-term care. Skilled nursing is confusing as to what the definitions are between skilled nursing, home health care, residential care. That's probably 2 or 3 other videos, but we do have one. Hospice care is covered. You pay zero. For your out-of-hospital expense, like I said, $198 isn't paid, and you got to pay that. The Medicare will generally pay 80%. A Medigap plan will pay that, so you pay nothing. Home health care, if you qualify for that, Medicare pays the whole thing, but be careful. You still probably should get extra coverage for home health care. Durable medical equipment, that's under Part B, so you pay the $198. Now, a Medicare doctor can charge you up to, I believe it's 15% more than what Medicare allows. So that's what this extra coverage is here, remainder of Medicare approved amounts, and they'll pay that. And one reason I like to use the actual brochure is if I make a mistake, well, you can see what the actual thing is, because I think I gave you the wrong thing. No, this is what I was talking about, the Part B excess charges above Medicare approved amounts. Plan will pay 100%, you pay nothing. This part here, where I was a little bit in error, I'm not perfect. I'd like to be, but I'm not. That's under home health care. Now, Medicare does not cover outside the United States, except like if you live on the border and there's a hospital in Mexico or Canada that's closer than an American hospital. But basically, they don't pay. So you need a travel policy. If you've got Medicare Advantage, that'll pay up to $50,000. And it's only 60 days of your trip. So if you're going to stay longer than 60 days, you need a travel policy. And this is emergency care, not just if you have a cold. So going back to the Medigap plan, our next thing is the A through N chart. And A through N, not all companies sell all plans. The most popular plan was Plan F, but that went away. But if you already have it, your grandfather, that went away. Now you can get G. And on this chart, and this is an official chart from the government, the only difference is the deductible. And then, check your rate chart for what it is. Now, the best time to buy a plan is when you turn 65, because then you don't have to answer any health questions. And as you get older, it gets long and complicated, and the insurance companies are there to make a living. Basically, under Obamacare, and it gets technical as to whether Medicare is in that same thing, but overall, the insurance companies, for every dollar they take in, they have to pay out 80 cents in claims. And if they don't, they give you your money back. So if you look on my website, unless I've deleted it because it's historical, but if you look on my website, you'll see that insurance companies have given rebates if they, took in more money than what they were supposed to, being as they're supposed to pay out at least 80%. If you've got employer coverage, then you don't have to buy Part B. And when you do buy Part B, then you get a separate enrollment period into a Medigap plan, even if you're 70 or 80 years old when you finally retire. But this gets very confusing. So be sure you double check it. And we've got a whole page on our website talking about employer coverage and what's better for your situation, and making sure you're not going to get an enrollment period. And there's a little snafu there in that if you have COBRA, you'd think it's employee coverage, but they don't count it that way. And then here's a list in the official government publication of the times that you can get into a plan. So don't just call me and say, Steve, when can I get in? I got to look at this because there's a lot of times and I don't have them memorized. And these are the federal rights. The California rights are on this page, and I find it a lot simpler. Just here I've summarized the enrollment periods, but it's basically when you turn 65 or in California on your birthday. So this video is really only for people in California, because I don't know how many other states have a birthday rule. But in California, on your birthday, you can switch to a lesser coverage plan or equal, and they just changed the law to 60 days before or after your birthday, but double check that. So, we've got my summary here, and then the actual guide from the insurance company, what proofs you need. And then here I've cut and pasted the actual law from the state of California website. So that's the guaranteed issue rights. Here they're talking about how does Medigap pay your bills? Well, when you sign up for a Medigap plan, the application includes a provision that Medicare can send them your claims, and then your insurance company just pays. I'm going to adjust this a little because I live in San Pedro. I think I'm Croatian. We talk with our hands. So anyways, the Medigap plan just pays based on what Medicare pays. So it's not like if Medicare refuses to do your knee that your Medigap plan is going to pay it. No, they just go exactly by what Medicare pays and pay that 20%, the deductibles. And if your doctor charged more than what Medicare allows, they pay that too. Now, if you're on Medigap before you're 65, that gets confusing. We've got a whole separate page for people with end-stage renal disease. And the main thing is if you're under 65 and you apply for Medigap, it's going to cost you like maybe 3 times more than if you were 65. So as soon as you turn 65, you'll want to reapply under the either birthday rule or just as an open enrollment, for turning 65. So, be sure to also visit our page where we're putting all these videos for introduction to a seminar, because we're not interested in doing, the dog and pony show at the restaurant and worry about all the little rules, because you can serve coffee and donuts, but if it's a meal, you can't. And so anyways, we've got it here online. You can watch it 24/7. I've tried to keep everything on this page generic, and this video that I did like 6 years ago, I'm going to replace it with the one you're seeing right now. So we've got like all the information you need. And if we see something we don't have, just, click here under enrollment and questions. I'll get an email immediately, or go all the way to the bottom of the page and you can ask a question. It says leave a reply, but my web developer is updating that to ask a question. So thank you very much for watching, and subscribe to our channel. You can see more videos as they are produced. Thank you.